So I want to talk to you a little bit about the history of hormone therapy pellets. First of all, bioidentical hormone pellets are hormones that are biologically identical to your hormones. So bio means biology or body, and identical means the same as. So it is the same chemical structure that your body produced prior to going into menopause or andropause for men. Estrogen and testosterone are made both in your ovaries and in your adrenal gland. Bioidentical hormones have the same effects on your body as estrogen and testosterone did when you were younger, but without those monthly fluctuations or the ups and downs that you get when you have period. Bioidentical hormone pellets are plant-derived and they're FDA monitored, but they are not approved for female hormone replacement. The pellet method of hormone replacement has been actually used in both Europe and in Canada for many, many years, and by select OB-GYNs in the United States. You will have similar risks as you had prior to menopause from the effects of estrogens and androgens when they're given as pellets. Patients who are premenopausal are advised to continue reliable birth control while participating in hormone pellet therapy. Now, testosterone is category X, which means it will cause birth defects, and they cannot be given to pregnant women. Now, what are the benefits of testosterone therapy? These are going to be increase in libido and energy, increase in the sense of well-being, increase in the muscle mass, and in your strength and stamina, decrease frequency and severity of migraine headaches, decrease in mood swings, anxiety, irritability, and depression, decrease in weight, decrease in the risk of severity of diabetes, decrease in the risk of heart disease, and special bonus decrease in the risk of dementia and Alzheimer's disease. Now I want to go over the potential side effects and the potential surgical risks. Potential side effects of hormone therapy pellets are similar to those related to traditional testosterone and estrogen replacement. These include extrusion of the pellets. In other words, they might pop out, but it's very unlikely. Hypersexuality. In other words, you are wanting to have more sex. Lack of effect or no effect at all. And breast tenderness and swelling, especially in the first 3 weeks. Now, this is only going to be related to the estrogen pellets, not the testosterone pellets. There can also be an increased growth of hair on your face, similar to premenopausal patterns. There can be water retention, but that's usually just with the estrogen pellets. There can be an increased growth of estrogen-dependent tumors, such as uterine cancer and breast cancer. Birth defects in babies that are exposed to testosterone is another potential side effect. There can be growth in liver tumors if they're already present, and there can be a masculinization of the voice. There can be an enlargement in the clitoris. The estradiol dosage that you receive could potentially aggravate fibroids or polyps if you already have them present, and that may cause some bleeding. Testosterone therapy can also increase your hemoglobin and hematocrit, or your blood count, and usually that's not of any consequence. So it's not really a risk, it's more of something for you to be aware of in case it's noted in your blood work. The potential surgical risks are really going to be the same as any minor medical procedure. These potential overall risks include bleeding, bruising, swelling, infection, pain, and reaction to the local anesthetic and its preservatives. So what are the estrogen benefits? Well, it prevents a whole slew of diseases that tend to kill us in our older age. And those include coronary artery disease, cardiovascular disease, Alzheimer's disease, colorectal cancer, depression, mood disorders, atrophy of the vagina, sexual dysfunction, glaucoma, cataracts, macular degeneration, bone loss, gingival atrophy, diabetes, dyslipidemia or high cholesterol, and it even helps with chronic pain. That's a lot. Now, what are the benefits of progesterone? Well, it can lower your symptoms of PMS, of perimenopause. It can protect against breast cancer. It can protect against osteoporosis and even heart disease. And it also can improve cognition and memory. And then finally, it helps you to sleep much better and to have no bleeding if you're in menopause, or control your bleeding if you're premenopausal. Now, what are the testosterone benefits? Well, it can prevent coronary artery disease, Alzheimer's disease, prostate cancer. It also improves depression and mood. It improves erectile dysfunction, orgasmic dysfunction, low libido, and even insulin resistance. It also improves memory and cognition, prevents osteoporosis, and it can improve your fat to muscle ratio. And in some cases, it can actually improve hair loss. What are some of the symptoms of hormone imbalance? Well, those are going to include depression, moodiness, anxiety, low stamina, insomnia, lack of focus, lack of drive, low libido, orgasmic difficulties, erectile dysfunction, inability to lose weight, hot flashes, night sweats, and brain to mouth fog. In other words, you can't get what's up in your brain out through your mouth. So these are your post-insertion instructions. First of all, you're going to have 2 layers of dressing. The first layer should come off within the first 24 hours. Now, if it does get wet before that time frame, go ahead and take it off, but try not to get wet. Secondly, steri strips is the next layer, and those will fall off between 3 to 7 days. If they don't fall off by the 7th day, then go ahead and take them off yourself. We recommend that you put an ice pack over the site for the next 4 to 5 hours every 20 minutes. And then also do not get into a hot tub, a swimming pool, a jacuzzi for the next 3 days. And it's okay to shower, just make sure you don't scrub the site. Then once you're at about 7 days, it's okay to go ahead and start cleaning the site. We recommend that you put an ice pack over the site for the next 4 to 5 hours every 20 minutes. And then also do not get into a hot tub, a swimming pool, a jacuzzi for the next 3 days. And it's okay to shower, just make sure you don't scrub the site. Then once you're at about 7 days, it's okay to go ahead and start cleaning the site. No major exercises for the insertion site. We don't want the pellets to become extruded. So things such as, that's going to require movement of the area where it was inserted, things such as running and elliptical, or even sex, because you can have a pellet extrusion. No major exercises for the insertion site. We don't want the pellets to become extruded. So things such as, that's going to require movement of the area where it was inserted, things such as running and elliptical, or even sex, because you can have a pellet extrusion. The insertion site may be uncomfortable for 2 to 3 weeks. If there's a lot of itching, then you can take oral Benadryl, 25 to 50 milligrams every 6 hours as needed. And keep in mind, it can cause drowsiness, so definitely don't operate any heavy machinery, make any major decisions if you take the Benadryl. Sodium bicarbonate that is used during the procedure can cause some swelling, so don't be surprised, and it can last 1 to 3 days. You might notice some pinkish or bloody discoloration of the outer bandage, and that's going to be normal. But if you experience bleeding from the incision, apply firm pressure for 5 minutes. You've got to count it on the clock, because otherwise it's not going to be effective. And then if you notice that it doesn't go away after putting pressure on there, this is not normal and you need to call us. Please call if you notice any pus coming out of the incision, because that's definitely not normal. Remember to go to your post-insertion blood work to be done at 5 weeks. And then at 6 weeks after the insertion, you'll come into the office to go review your results. Most women are going to need a repelleting at 3 to 4 months, which is different for men, which is at 5 to 6 months. The time that you will know when to come back is when you start feeling the symptoms that the pellets resolved. So definitely make an appointment at that point in time. And again, for women, that's 3 to 4 months. And the charge for the repelleting will only be for that portion and not for the consultation. All right. Please call us if you have any questions or concerns, or email us. Thank you.